Should minors be able to purchase birth control without the parents' consent? This is one of the biggest raging topics in the US, all over the world actually, because it truly brings so much different opinions and perspectives on this, and that is why one of the many reasons I am going to cover this today. Why it is so important and understand this topic and ways, purposes, and reasons why birth control is used. Birth control is one of the most commonly used forms of sexual protection amongst the use of it for other hormonal conditions in women for years now. 75 to 80% of women take some type of birth control. IUD, pill, patch, whatever it may be, shot even. There's many different ways where this is a very commonly used medication. It is also one of the most frowned upon medications, because birth control can be seen as a good or bad thing. And this can be because of religious views, political views, or just own perspectives, but is one of the most raging topics, and this is why I want to cover it today. The side of parents and legal guardians technically is one of the most commonly parental opinionated on this topic. So they love to talk about this and they love to put input on it. And I think why we find that all of their talk about it is so negative is because of this reason. And for generations, parents have had really mixed feelings. And this is why a big percentage of parents have noted that the reason they are so against their adolescents taking any type of birth control is not because of the reason that they are against it. It's because of what they feel like it might lead to, or they simply just don't know what it is. They don't know the side effects, and they feel that they don't know enough about it to allow their child to take this. And I truly believe that because of this could be changed. And the reason behind this is because they openly admitted that if they had more education on the health positives that it can do for a teen's condition in their body, then they might be more apt to allowing their child to take it in the first place, and their perspective wouldn't be so negative. There's also factors of religious and political, like I had mentioned beforehand, but parents all over the country have openly said that it is so important for them to know the background knowledge behind something before letting their child do it, or regardless, take it for their body. So I think that one of the main things that we can do is make a change by implementing more research or knowledge for these parents to have before they go into having this discussion with a doctor for a child to take this medication. So even if this is just a possible option for their child, the more research is, the better. The more that they can feel that they're confident in what they're taking for their child, the better. So I think those little things of implementing those is truly so important. The next side I'm going to do is doctors and medical professionals all over the area. I did an interview with a nurse in Santa Cruz, California about this topic. Healthcare providers all over the country are very well educated on birth control. The medication in general is something that they have to learn about in their schooling, and this, whether they support it or not, is definitely dependent on their individual perspectives, but most healthcare professionals support the education that comes with birth control. And I think one of the biggest reasons that they discussed about any possible manners of this is because of what it can affect for a child. They do stand behind the fact that abstinence of sex is definitely 100% the best option when you are not ready for pregnancy to be a desire. But birth control can also be used for treatments on different diseases or conditions in a woman's body that can truly help them as well. And they do stand behind the fact that teenagers and adolescents with emancipation rights or any of the above should be able to birth control. There's a lot of circumstances where adolescents or young adults don't have that option because whether they don't know where to get it or they just truly aren't allowed to get it without that legal parent guardian signature. And I think it's so important that an adolescent with the right testing done and the right research done is able to take care of the body with what they're needing to get taken care of. If a woman is having PCOS problem or even just endometriosis problems or any of the above, they need to be able to take care of that pain. And Obviously, not every circumstance when an adolescent or teenager comes into an office doesn't mean they're going to be put on birth control, but they can seek that medical professional help and hopefully get an answer of what can help them. And medical professionals agree that emancipated young adolescents should have the option of purchasing birth control for themselves, or at least going to a medical professional and getting a prescription for one. So that way they're able to help their bodies without having to find or track down a parent that might be abusive or might be in a worse circumstance. So they believe that it is crucially important that you are doing the proper research, that you are having the doctors correctly test you for which birth control will work right for you. Of course, just like any other medication, birth control can harm you, and it does have negative side effects. Just because birth control is used for different things like stopping pregnancies or slowing down cycles or any of that, it can have negative side effects just like a regular prescription or over-the-counter medication. And that's why it's so important that you go to the correct healthcare professional or even just seek out that research so that way you know what brand or what type of birth control works best for you. Birth control, if taken wrong or not correctly, can harm your body. Psychologically, physically, mentally, emotionally. It can do all of that, just like anything else you would take or input into your body. So again, medical professionals highly suggest seeking out medical professional help, or even just going to a local clinic, Planned Parenthood, or any of the above to get some research done, testing done, or get some help to help with the conditions that you are experiencing. The next side I want to cover is going to be the perspective of myself. Birth control is something I got introduced to at a very young age. Not for the common reason either. It was because I had a disease called endometriosis. I had extreme pain and it caused life-altering symptoms for myself. After I tried multitude of different birth controls and different regulations, I had multiple surgeries because nothing seemed to work for me. And this was just so frustrating because I saw my friends being able to live their lives and I just couldn't because it affected what I did on a daily basis as a young teen. I was very fortunate to have a supportive and understanding mom, but this isn't the case for every young girl. And after working in healthcare for some time, I've noticed there are so many girls that just aren't educated on birth control and truly just want to treat their symptoms because their friend did it and it worked for them. But just because it works for them doesn't mean it's going to work for you. That's why it's so important to get that research done for yourself and get that testing done for yourself. It is truly so beneficial to give the information to young girls all over if they seem like they need that help. Give them those resources or even just point them in the right direction because not everybody is as fortunate in situations with good parents like myself or even you might be. So it is so important that we draw them the right way, or even just give them that research the best that we can by handing out pamphlets or even just giving phone numbers to doctors or pointing them to a website on the internet, any of that. So that way we can get those girls that are less fortunate to know what birth control is and what is best for them and get those doctor appointments, that we can point them the right direction and they don't have to go through the process of harming themselves or their body in the process. I want to wrap up this speech by just saying that birth control is a method to help many teen and adult women out there. It does help with many different conditions and overall symptoms that we experience because of our hormones. And I believe that today's society has gotten so many more resources and connections out there, so we're able to utilize them to help with this big decision in our life. Remember that the importance of seeking medical professional help and advice should be and always should be the number one thing that you do. Let's encourage other women out there who might not know or understand the topic of birth control, that we point them the right direction of research, resources, or any of the above, so that way they can have the connections that we do. So be kind, help others, and draw their attention to the right form of medical professional help.